And the final thing I want to just say, and then I'm going to give you both an opportunity just to kind of wrap this up, with anxiety and fear, and just kind of maybe talk to patients that are watching this, and still kind of, just kind of taking this all in. But something that just dawned on me, that one of the biggest fears I think that people probably have is to hear that they're going to be sedated or whatever. And for the first time, maybe they just meeting their dentist or, whatever the case. But with these videos that we've done, and we've got to know you guys so well. Both of you have YouTube channels. Both of you have share your experience, taught patients or taught. There's so much comfort, I feel like, for anybody who wants to watch, to see before they even come into either of your offices, to know who you guys are as people. And to me, that takes 99.9% of the fear out of the question. I trust you guys because I've seen you guys. And I just think that's so neat about being able to watch a lot of these videos and to see who you guys are as people, as well as doctors. So Dr. McCawley, I'm going to start with you. Any last words around the topic of fear and anxiety for your patients?
Well, I think they need to know that the procedure will not be painful. So they're used to thinking it's going to be painful. With the sedation and with the procedures we're doing, it's not going to be painful. They're going to be completely numb and relaxed. And also, they're worried, how much am I going to be in pain for days? No. They might have mild to moderate pain for a day. They can go back to work the next day without a problem. So I just think I would just want to reassure them that we've done this thousands of times, and patients almost always say it was nothing like I thought it was going to be. So just really don't worry about this. You're going to be fine. This works great.
And basically, I have to agree, we do everything we can in addition to the IV sedation to make these patients comfortable. We give them a blanket if they're chilly. We play music for them so that they're comfortable. We put something over their eyes so they don't have to see the instruments. They're not going to be looking at the instruments. It's kind of like when you wear a sleeping mask. We just put something over their eyes, which they're really comfortable with because they don't want to look at the instruments in front of them particularly. And so we really do. We go to great lengths, and then with the laser, of course, really minimal or no discomfort, not just during, but afterwards. So we reassure them, you're not going to have pain, you're going to be comfortable, we're going to do everything we can to make sure that this is we're trying to get discomfort outlawed in our practice. So it's going before our counsel, but seriously, very little discomfort. Patients are really pleasantly surprised at the lack of discomfort and the great result of what we can do, particularly with the laser. So it's gratifying to me, and I know to Tom, to help patients, because that's what is better. What is a better purpose in your life than helping other people, especially helping them get healthier and feel better and get over a fear that they may have had for many years.
So that's really our purpose, is to make a positive difference in people's lives. And by allowing us to treat these infections that can cause them to lose their teeth and create many health issues, heart, Alzheimer's, make diabetes worse. What a greater gift to people. One of the best things that could happen to a person is to get into Dr. Nemeth or our office and get this minimally invasive treatment that will allow them to save their teeth and manage many health issues that are related to inflammation.
When I talk to a patient now, I'm emphasizing even more than the mouth, even more than their gum disease, how it affects the rest of their body. These bacteria and the effect of them goes throughout your whole body. Virtually every part of your body is affected in a negative way. So it's really important to let these patients realize they're not going to have fear. And by getting rid of the mouth infection, they're going to feel better and they will be healthier, because gum disease is related to almost every other systemic or physical disease that you can name. And there are over 50 that are affected by the inflammation that you have when you have gum disease, because that gum is connected to the whole rest of your body. As I've said so many times, if your mouth is not healthy, you cannot be healthy. It's simply not possible. So a healthier mouth, you're going to have a healthier body. And I know Tom feels the same way.
Well said, Joe.
I can't think of a better way to end it. I've heard you guys say for years, and it makes complete sense to me that the mouth is the gateway to our whole body. And when I first heard you say that, I was like, yeah, that makes complete sense. So thank you guys so much. I want to let everybody know two things. One is, these guys are super, super, super busy, and they don't have to do this. Their practices are extremely busy, and they do it because they care and they want the right information to be out there. So I hope you know that, and you could sense that on this interview today. And the second thing is they're the best in the biz. They really are. So if you're in the Metro Detroit area, Dr. Nemeth, anywhere really in the Midwest, he's the guy for you. And then down in South Florida, Dr. McCawley is down there, and they would love to set up an appointment, talk to you, have a conversation with you. Thank you both for taking the time. Really do appreciate it. You guys are great human beings and great doctors, and we'll do this again. So thanks, everybody.
Thank you for providing this opportunity to let us get the word out.
Thanks, Corey.
Everybody.
You're very welcome, gentlemen. We'll do it again soon. Thanks, everybody. Have a great day.